I'm Reeves Kurtner, and this is Season 2 of In Your Business. In Your Business is presented by Moses Auto Mall of Huntington, online at mosesmeansmore.com, and powered by the Huntington Regional Chamber of Commerce and Kindred Communications. This week, we're honored to be joined by Melanie Hall, President and CEO of Hospice of Huntington. Hospice of Huntington is dedicated to providing compassionate end-of-life care to our community, as well as a number of other great services. Our discussion will focus on the strategies they use to build trust and awareness, their commitment to community, and more. Let's get in your business. Thank you so much for joining us this afternoon and to tell us all the good things that Hospice is doing, Hospice of Huntington. Let's start with, give us a brief overview of Hospice of Huntington and the mission.
All right. Hospice of Huntington has been a nonprofit organization that was founded 42 years ago as a volunteer organization by a lady named Laura Darby, a very familiar name in town. And Laura actually started Hospice as a nursing school project. She was getting ready to graduate. It was part of a nursing school project. And so she wrote her paper on starting a hospice in Huntington, West Virginia, because she had heard other places in the United States have them. So she wrote her paper on starting a hospice, and then when she graduated, she started the organization on a volunteer basis.
Got it.
And then in 1983, Medicare said, hey, we believe this is the best way to take care of folks that are end of life. And so they made hospice services a Medicare benefit. So anybody who gets Medicare, hospice is a paid-for benefit for them. And it is the highest level of support and care at home or anywhere they call home for somebody who is seriously ill, end of life. And so we've been doing that for 42 years. We cover Cabell, Wayne, Lincoln, and Mason counties in West Virginia, and Lawrence, Gallion, Meigs County in Ohio.
Yeah, and talk about, too, in those 42 years, how much it's changed and how much it's evolved, which you were just telling me about just now.
Totally. Yeah. So in 42 years, obviously the world's changed a lot.
Let me back up. Mm-hmm. What was it like 42 years ago?
So 42 years ago, obviously everything was on paper. You charted on paper. Yeah. There were not as many resources. There were not as many medical supplies. There were not as many cures for diseases 42 years ago. And so medical improvements have helped. But there's also been a change in people. 42 years ago, you were probably a little closer to somebody in your family or somebody that could take care of you if you were facing end of life. And that's less now than it was back then. So I would say family dynamics have changed somewhat in those 42 years.
So now, again, what all has a hospice added? It's a lot more, as you were sharing with me before we got started.
Sure. So probably around 2018, we really kind of began to put in place things that we saw happening as families were coming to us with hospice and realizing, wow, these caregivers and these families need a lot more help. Hospice is the highest level of support they can get, but it is, there is a medical eligibility to that. And so we were thinking, what are there things that we can do to help families a little bit earlier, so when the time comes they are coming to hospice, it's not so stop and go. There is a smoother transition, a little more support early on, because folks were facing some of those challenges of not being available or still having to work, or still having to care for children, or the caregiver is elderly and ill themselves. So we began to open what I call the non-hospice services of Hospice of Huntington, because it was really kind of hard for folks to wrap their mind around Hospice of Huntington doing other things. Right. So we opened a DBA of Hospice Huntington called Tri-State Life Care. It is a nonprofit services of a nonprofit organization, Hospice of Huntington. And we have since opened 3. One is private duty caregiving. You need hire somebody to come sit with somebody. We can do that. We opened a home palliative medicine where we send a medical provider, a nurse practitioner, a PA, or a physician into the home to kind of help work with the families and work with their primary care physician or their specialist, because oftentimes they have trouble getting to the doctor, so they miss appointments, and then it's a vicious cycle. So we kind of are that bridge from a medical perspective, who can write scripts and things like that. But then we heard about other things in the nation, another source in the nation, and that was medical adult daycare centers, which are different than social day centers. But we heard about medical adult daycare centers, and our board really began to look at that and say, hey, I think that's something that we feel like is needed in our area. So through a collaboration with Senator Plymel, working with the Bureau of Medical Services, we were able to open last fall in October, West Virginia's first medical adult daycare center. Like I said, there's others in West Virginia, but this is West Virginia's first. And so it really opens a highly affordable care location, and it isn't just babysitting. It is medication management, skilled nursing services, cognitive brain activities, skilled activities, nutrition, and then they can get medical services, PT services, showers, haircuts, medical massage. There's lots of varieties of medical services on top of that you can add while they're there at the daycare.
Sure.
And so it really gives a high level of caregiving at a very cost-effective price.
Is part of the reason that hospice has added like these additional services, is this where people are living longer?
People are living longer, yes.
Yeah.
Sometimes they're living longer but still have physical challenges.
Yeah, right.
So I might live to my 90s, but I may not be as mobile as I need to be to live independently.
Sure. Yeah.
And so we have seen these kind of additional services help folks live longer independently, safely.
Right.
And have their families have a peace of mind that, mom's okay to live independently for now.
Yeah.
We may have to make some other decisions later, but for now she's doing well and has support and eyes on and that kind of thing. And so, we saw the need in the community, and that's where we went to.
So, today I want to talk about, trust and also getting kind of into awareness. And I don't know of any businesses where trust isn't important, business or nonprofits, whatever.
Right.
Especially with hospice.
Yes.
Talk about how important the trust of the community is to hospice and your mission.
It is one of our core values, and it's a primary value that we uphold, and we uphold very tightly, because if you don't have trust, you don't have much anything to offer.
Yeah.
And so folks have to trust us. There's a lot of confusion and misconceptions around death and healthcare and hospice, and people have a lot of confusion, and a lot of it has maybe depend on prior experience or prior communication. And so we're doing a lot of teaching constantly about what is hospice, what does it mean for you and your family, and encouraging folks to trust us and to train our people and to behave in ways that are trustworthy.
What do you think are some of those strategies you mentioned, like teaching? When do people learn about hospice? Is it when they're at the hospital and the end is near, and someone says like, hey, we recommend, a social worker says we recommend you call in hospice or whatever? How are they learning about that? How's that process go?
So people usually have heard the word hospice somewhere in their life, and then they develop some kind of connotation, a good or bad, confusing, leave it far away from me kind of concept about what hospice is. And usually it isn't until someone is saying to them, we'd like to refer your family to hospice, or we'd like you to consider hospice, or, let hospice come in and talk to you. And that's when they really, I think, are most interested in hearing what the hospice service is, and the main thing is to really just listen. It is a Medicare benefit. It's an insurance benefit. You can come in and out of it. You can sign in, sign out. I think there are some misconceptions, and so really just trying to take folks at their teachable moments, and maybe now's not the time, and some folks might be blessed to have a wide time to think about it, and some folks may not. And so just as medical, and sometimes medical providers are not 100% sure, not comfortable talking, and so there's a lot of teaching that has to go on.
How do you do that? How do you do that teaching?
We do with the providers and
everything. Yeah, again, going back to the trust part of this and the community part of this.
Yes, I think that from a trust perspective, patients and families, it's communication, and it is with providers as well. Please call us if you have questions. Please call us if something happens, or we're calling them to follow up and check and build that encouragement, because really really, hospice is a total change from what they've experienced in the healthcare industry all up until that point in their life. It's always been, going out and seeking a provider for an illness. When it comes to hospice, we're really walking that journey with that patient and family. And so we're really reaching out on a way more regular basis, or more accessible than they've probably ever experienced in healthcare. So it's really kind of changing a new way to even interact with a healthcare entity.
So you mentioned a couple times now misconceptions. What are some of those misconceptions?
I think a lot of people, their first misconception about hospice is, you're giving up or you're taking away from something that could, and that's not the case at all. Medical eligibility for hospice is when if there's curative or aggressive treatment, it either isn't available, they don't want it, or it isn't working. And that's all a patient choice. It's all a patient choice. They have to choose, and then they can change their mind and revoke and go back to something else. So it's not the once you get in, you can't get out type of a thing. I think the biggest misconception for people to understand is if you're referred to hospice, if folks have really had the tough conversation with you or your family to refer you to hospice, I think it's important to generally recognize that the train is kind of heading that way.
Sure.
And I think, as much as we don't want to think about it or talk about it, it's kind of putting your head in the sand not to say, let's at least listen. Let's at least talk.
Course.
We don't have to do anything, but let's at least listen and talk.
Yeah, sure. How do you try to overcome those misconceptions?
Just education, talking constantly with the folks that we are referred to us.
Sure.
We're working regularly to talk with the medical providers in the community, the folks in the hospital, the general public. We go to churches and civic groups and that type of thing and try to begin to teach. Nobody likes to talk about end of life.
Of course not.
It's not,
No.
They're much better fun speakers, but it is something that will happen to all of us.
That's right.
And our perspective is, in order to live well, if you have the end and you have a good understanding of what's going to happen at the end, you can take the time that you have right now to live well, to be with family, spend time together, and that's important.
Do you think that those misconceptions, that trust, how do you think that's changed over those last 42 years or so?
Well, I think it obviously with mechanisms of communication, it's a little easier to get messages out to a broader number of people, with the internet and some of the things that weren't available.
But also
42
wrong
years
messages,
ago.
though, too.
That's right, wrong messages.
Yes,
that's right.
Yeah.
Good ones and bad ones.
That's right. It's easier to communicate. Yes.
It's easier to communicate good and bad. So I guess you fight that on both battles, but on both fronts. That has been the biggest changes to get that communication.
Sure. Talk about all you mentioned. You going out into churches and so forth. But what programs does hospice offer, like community outreach type services and programs?
Sure. So obviously education. Talking about education. The Tri-State Life Care Services we've opened are really community outreach programs. They're services, but they're also programs at the daycare. There's an Alzheimer's support and a Parkinson's support group and an essential tremor support group. So we're doing group activities and things like that just to educate around diseases.
Sure.
One of our biggest community education pieces is our bereavement program.
Okay.
And so we'll provide bereavement during the time and even up to a year or longer afterwards, whenever they need it.
Whatever it takes,
And it doesn't even have to be someone who had a relative in hospice. It can be anybody from the community. And it's no charge. It's free, and we do individual, we do group, we do activities. We have a special children's focused bereavement service called Camp Good Grief, and we take it on the go, and sometimes we have events. So really focusing on bereavement and healthy bereavement, because folks don't have the opportunity to move through bereavement well, it affects them the rest of their life.
That's
and so to be able to be healthily grieving and moving through that, you never forget that loved one, or you never forget them.
Yeah.
It's just carrying the grief a little different as you can move on through the rest of your life.
And so you said, these are Medicaid funded programs, Medicaid or Medicare or both?
Both. Medicaid, Medicare, private insurance, as far as hospice or all the other ones, of them actually.
Part two, I was going to kind of ask you mentioned some of those free services, like the bereavement programs, Camp Good Grief. Parkinson's support groups. Where does the funding for that come from? Is that grants? Is that fundraising?
No, yeah, we just
sure. Talk about that.
Right, we are a nonprofit organization, and we are absolutely blessed to have some folks in the community who believe in what hospice has done for them or their family, and so they are, or they've just heard of it. They know what happens, how we care for folks, and what we've provided, and so they're donors. They make donations and provide the funding to allow us to do some of those free services to folks who would never be able to pay.
Do you all partner with? We'll talk about that. I know you do. I believe you do.
Yes.
What organizations, schools, churches, etc. Who all do you partner with and do programs with?
Everybody.
Yeah. yeah.
List is long.
Yeah.
Yes.
I mean,
we reach out to schools. We reach out to churches. We reach out to the civic groups. The veterans groups.
What do you do with the veterans groups?
So we provide obviously services to all veterans. We also focus on specific veteran recognition. Oftentimes at end of life, there's a lot that the veteran is processing, and so we have some special programs. We honor veterans that kind of make a special time to recognize veterans and give them an opportunity to work through some of those things at this time.
So you mentioned like social media and online and so forth. How does hospice use social media today?
So we have social media sites, we have websites, and we have a hospice one, and we have a Tri-State Life Care, just so we don't confuse the world.
Is that important to keep those separated?
Well, I don't know. Maybe sometime it could be together. I don't know. But since the Tri-State Life Care is relatively young, 2018, we've kind of found it made the communication a little simpler, because if folks are...
If you hear the word hospice, you're going to think hospice.
Right. I mean, the needs of the folks who are looking for hospice service are a little different from the needs that are looking for a daycare for an adult that's a little more active. So that's kind of why we have two. But we have a website, social media sites. We flyers,
what do you all use those for? Like what are you trying to accomplish with that?
Education, as well as information, announcements, events, and just sharing what this is about. Sharing resources, if there are resources or an event that's happening that we think that would be something that would be good to share. We do put those out as well.
How many events? Like what kind of events you all?
Well, we do. We have fundraising events, and then we have education events. So if we're doing a support group, or if we're doing a webinar, we're participating in some kind of a community event, and we're going to have a display there, like a health fair or something like that. We'll make sure that we have that information, our calendar, and that kind of thing on those pages.
Volunteers has always been a big part.
Yes, we love our volunteers.
And your volunteers, again, going back to the education part and going back to the misconception part, right? Your volunteers can be like your missionaries telling your story.
Very much so.
Talk about your volunteers, your volunteer program. How many do you have? What do they do?
So our volunteers, a wonderful resource of folks, and we kind of, because we're a licensed organization, the folks that are actually working with patients or patient information, that kind of thing, have to go through a little higher screening. They have to go through some background checks, and that they have to be vetted, like our staff would have to be. So that's a very dedicated volunteer who's willing to kind of go. I mean, it's an in-depth screening, so we make sure that all that stuff is safe, and so those are the dear folks that spend their time helping make phone calls or help with records, or they're sitting by the bedside, they're helping in one of the facilities, interacting with patients, and so those are our direct volunteers. If someone doesn't want to quite get that close, we have community volunteers who help us with community events, who help us with fundraising, who help us, take care of some of the needs at the hospice house. There's a lot of needs to keep it upkeep and
Sure,
nice, and so they're great to do that from a community perspective.
Yeah.
And then folks can just generally volunteer. Some folks are gifted at fundraising or planning fundraising events or planning outreach events or planning education events, and so they can do that on a volunteer basis as well. So we try to find a space within hospice for folks, they don't want to sit with a patient and read or sing, or they want to, stuff envelopes, whatever. We try to find a place for the volunteer. We've even had a great opportunity of volunteers from health sciences students, medical students, nursing students, PA students, helping with doing some of the varieties of work for
How many volunteers do you have? Would you guess? Or
it fluctuates, probably amongst all those different types of people, probably around 150.
That's a lot.
But it is a lot.
Yeah,
and we have, we are so appreciative of our community support. Some folks are real involved, some folks are kind of involved, some do this part, some do that. But if I was trying to say a totality.
Yeah, that's right.
But many come to us as volunteers after having an experience in their family or in some capacity. They now know what it means, and so
maybe a volunteer touched them.
Yes,
right.
Yes, absolutely. They interacted with a volunteer, or they think, I want to help this continue, and it is such meaningful work. I mean, there's very little else that you'll do to really help another person is to really help them in one of these hardest journeys of their life, and so it's wonderful to have so many people be so supportive.
I know the answer. I guess the answer is going to be both. This next question, but it's who the hospice is really, they're serving the person that again, from the end of life care, the person that is towards the end of their life, but it's also just as much, if not more, for that family too, right?
Totally,
like it's
absolutely.
Talk about the balance, I guess.
It is for both, and clearly the benefit is structured for both. Everything we do is for both, and for me, I really lived that coming to hospice. I've been there 10 years ago, and when I came to hospice as was just hired as the president and CEO, my dad was already diagnosed with cancer. So I really knew coming to hospice, at some point we were going to be on the other side of the table. And so living through that experience with my father and my family really kind of helped me see how much hospice really was, not just for the patient, and they did an excellent job, but how much it really was for me and the rest of my family. Not only in that moment, but years down the road.
That's right.
Really having that connection and really working through that.
Well, and again, only one person is passing away, hopefully, right? I mean, hopefully it's one at a time, but you got 3 kids and a spouse and grandkids or whatever. You got a whole entire family that's right. You need to be there for too.
And some are in town, some are out of town, some are close, some are far, some relationships are, there's just a variety of family dynamics. And so we find, how can we help this family? And it might be this member this time, this member in another way. And we just, we're here to help however is needed.
You mentioned the hospice house earlier. How long has that been there now? Over 10, 15 years?
2006.
Okay.
Yes, is
so
when it was built. And it really, I call it the house that the community built, because it really is. There are many hospices across the United States that do not have hospice houses.
Really?
Every hospice has to make provisions for what's called the general inpatient level of care, that high level of we're really ill or we need respite or whatever. Every hospice has to make provisions for that. Many make those provisions in a nursing home.
Okay.
If they don't have a hospice house, they're making those provisions through a relationship with a nursing home or a space in the hospital. But our community is blessed with the hospice house, and it was funds from many that went together to make that happen. And if nobody's been there, I would encourage them to go on the website and take a look, because it is as much for the patient as it is for the family.
Yeah.
Just the high level of a kind of a high intense nursing unit at the hospital, but comfortable enough to feel like home.
Are we lucky to have a facility like that here in terms of our size and so forth? You said other areas don't.
Yes, other areas don't, and it does really take community support to keep something like that going so beautifully and well. But it really is. Not every community has one. No.
I can't believe someone's 20 years old.
I know.
That
Time flies.
That is crazy. What do you again? We talked about kind of the the evolving of hospice, adding in these life care services. What do you think is next? What are the future plans for Hospice of Huntington?
Well, continuing to see what do families need? What do families need to be able to take care of their loved one safely, continue to work, continue to take care of their other children, continue to balance life and care? Because, we want to be able to take care of our loved ones and still continue to do, to work or preserve their income. A lot of times people are losing a lot of income just trying to find some way to care. And so our goal is to really help support them so that they can live as independently as long as possible at home, but when that time comes, still making sure that they are having that high quality palliative end of life care, wherever they call home, and that's kind of our goal. We're finding transportation is a need, so we'll have to look at maybe seeing what can we do to help get people where they need that are our patients. Get people where they need, but we just are making sure we don't, as we do new things, we're not letting the other great work slide. So we want to make sure you build new, but you always keep strong what you're currently doing. But the adult day is a super opportunity for folks, and I think that's really kind of just in the budding stage. And I hope our community really takes the time to take a look at it and recognize what can it do for their family, what can it do for the economy. It's going to be a very helpful, or it is we already see it, a very helpful tool in a tool belt for people that are caring for loved ones.
And is adult day through Tri-State Life Care, part of Hospice of Huntington, is that also funded through Medicaid, Medicare?
Yes, it is a nonprofit. So if someone wants to come to the adult day, there's several funding streams that can happen through. There's private pay. Yeah. And again, private pay is for the hour, for the cost, is less expensive than if you had one-on-one person sitting at home. Okay. And you're going to have a higher level of coverage. You've got a nurse, you've got activities that are structured, you've got medical services, all of that. So VA, someone's VA benefit, they can use their personal care benefit if they have VA services to that level. And actually, they actually get more time. They actually get 3 extra hours the way that it's structured through the VA benefit. So it's a very cost-effective or cost-beneficial mechanism for folks that are VA. And then adult age and disabled waiver for Medicaid. Okay. So if someone has an adult that they're not sure whether they qualify or not, age and disabled waiver is a little higher financial or a little lower financial benchmark. I would encourage them to reach out, and try to see if they are eligible for it, because age and disabled waiver money is available for that.
Hey, I asked that because you talk about there's a need, or some will say there's a need, and I'll agree with it, that childcare, right? So usually it's the unfortunately it's the woman who stays at home to raise the kids, and she's not able to contribute to the workforce and so forth. It's kind of the opposite of that, right? It's the son or the daughter has to take care of mom or dad, and they're not able to work and all that kind of stuff. And again, gives them that opportunity, and there is funding for it.
Yes, so, absolutely. So that's been a good thing to see as it's helped the community.
Absolutely. How many people? What year? 2018? You said.
No, this one started in 23, October of 23. So we're like, maybe 9 months old, something like that. So we're just getting started.
How many people so far in the last 9 months have come through?
So how it works is folks are enrolled. So there is an enrollment process. Okay. I mean, you wouldn't just drop your kid off to a daycare. Of course. There is there is a bit of an enrollment period, and where you have to make sure you got different pieces in place. And then once enrolled, folks can decide how often they want to come. I want to bring mom 3 days a week, 3 half days a week, or, they're coming 5 days a week, or whatever that is. And so that fluctuates. Our license allows us to take 24 people all day for the whole time that we're open, because we're licensed by OFLAC, the Office of Health Facility and Licensure. And so that can be 48 people half days, 24 people, all day. So that's growing. We're growing our number of enrollees. We're growing the number of participants. We're nowhere near capacity. So we got plenty of room.
Okay.
But it is, a lot of it is just, again, you mentioned trust, learning to trust. Hey, this is a resource that's trustworthy, and it is an excellent source of care. And that's, again, it's the same kind of messages as some of the other programs. It's what you don't know, you got to kind of learn about, and then you realize the value of it.
Are other hospices across the country offering the same services?
There are some. You know, what we see across the country is just different aspects of the healthcare industry are picking up different things as they see are needing in their community. So there are some hospices that have adult day centers. There's, you know, obviously they're all kinds of different.
Are there other hospices across the country doing things that we're not doing here yet that you could see a need for?
Maybe a few things. Okay. You know, I think we've probably covered it pretty quickly early on. Some of the things we want to at least get first. Settled into our area. Okay. We may look at some other things in the future. I mean, you know, the goal isn't to be as many things as you can.
That's right.
The goal is to make sure you're providing quality services and wrapping that family around as much as possible.
That's right.
And that's what we're trying to do.
Anything I missed? Anything else you want to add?
No, just I appreciate the opportunity to visit and share. And I would just, anybody has questions, again, you talk about trust or not sure,
please.
Just call, you know, get on the website, call if you're not, say, I've got this, and just let us know and we'll try to help guide them, because a lot of times it's a lot to navigate through.
It is. TriStateLifeCare.org to learn about those additional services. And then the website for Hospice of Huntington is?
www.hospiceofhuntington.org.
Easy enough.
Super easy.
And again, I mean, you said it, you all truly do God's work. I mean, what you all do, it is, and you know, like you mentioned, to your volunteers are just, they're special people.
It's a privilege to do the work. It's a privilege to work with the people who do the work.
And that's our episode. Thanks for listening. If you enjoyed this podcast, please like, subscribe, share, and even leave us a 5-star review. Season 2 of In Your Business is presented by Moses Auto Mall of Huntington. MosesMeansMore.com, empowered by the Huntington Regional Chamber of Commerce and Kindred Communications.